Good morning again, everyone, and welcome to Systematic Reviews with Margaret Foster, Session 1. I'm going to pass it over to my colleague, Brian Leaf, who is going to introduce our speaker, Margaret Foster.
Hi, everyone. This is Brian Leaf. I'm the Emerging Technologies Coordinator for the South Central region, and it is such a pleasure to be able to introduce Margaret Foster. This idea was born just this past fall, and we're so glad that we are able to make this happen, and we're also so glad to see so many of you. This systematic review series, the pieces of systematic reviews with Margaret Foster, marks a new series for us. Many of you may have attended our SCR Connection webinars that take place every month. And this series will be a limited run for the next 6 months on the first Thursday at this time from now until July. When we were developing this webinar, we want to add interactive components to it. So you may have noticed in the emails that I've sent out or that were shared that we have a hashtag for this webinar, hashtag PiecesQA. So if you have Twitter and are so willing, please answer questions that we ask on there, and you may see your responses or questions answered within these webinars. I don't want to take too much time from Margaret Foster, so I'm just going to give a very, very brief introduction to her. Margaret Foster is an associate professor at Texas A&M University and serves as the Systematic Reviews Coordinator at the Medical Sciences Library, with also a joint position at the School of Public Health and the College of Medicine of the Texas A&M University Health Sciences Center. She provides consultations for researchers in various disciplines and has published 25 articles applying or describing systematic review methods and evidence-based practice since 2009. I think the really exciting part, and Sarah will be throwing the link into the chat box right now, but she has a new book coming out in March called Assembling the Pieces of Systematic Reviews, which is where the title of our webinar gets its name. Each of these webinars independently are available for CE credit with MLA, and there'll be a survey sent out at the end of the webinar. But without further ado, I give you Margaret Foster.
Thank you, Brian. I was just trying to fix the problem with people not being able to get to the slides. So I'm just copying the link, and I'm going to share that. I think the settings on it was not as helpful as it could have been. So let me change over now to where I am sharing my screen, and we can get started. So just a second here. So hopefully everyone can see my screen. Trying to make it where I can see the chat as well. So good morning. I put the hashtags on here in case if you wanted to Twitter along, and I hope that you'll be asking me questions as we go along as well. I'm just moving this over here. Okay. So if you haven't had a chance to look at the upcoming topics of the next webinars, I have a quick slide here. So today we're going to be talking about how to determine if a research question is right for systematic review. And then next we'll be looking at searches beyond the typical databases, and then going on to look at what happens after the search. We'll talk more in depth about software. I'll mention a few during this talk. And then we'll go on to look at some other types of reviews that you may have worked on or heard about. And then we'll end up with what are some new developments in systematic review methods. And so the objectives of this session are we're going to talk about describing how do you determine if a question is right for a systematic review. And in that, we'll need to talk a little bit in the beginning about what are the differences between narrative, systematic, and scoping reviews. And then we'll also talk about where do related reviews fit in. And so one of my questions for everyone participating is, what is your level of experience with systematic reviews? So systematic reviews, they take a lot of time. They take a lot of planning. And they're very time-consuming, and for many of the clients that come to see you, they can be very daunting, and they may not really understand the process either. So it's really important in the beginning to really take the time to plan before jumping in, and so that's the part that we're going to be talking about right now. Also, many of my clients, this is the time that they almost feel is the most painful of the whole process. When I was working on writing my book, this was the process that I spent the most time trying to figure out how to convey what I've been doing. I've been working with clients on systematic reviews for over 10 years, and it was really interesting to try and write out what to do during this time period. So hopefully this is helpful to you. So here are the 5 steps for determining feasibility. So I see many of you are kind of starting out here. Some have done a little bit. Okay. Okay. So the steps for determining the feasibility are decide if a question matches systematic review method, and so spend a little time on that. Determining what the scope of the review, which is basically figuring out what is their research question. The very next step is to look at and evaluate any reviews that are related to that topic, and then kind of give an estimate of how many potential citations do you think they'll need to look through, and finally, putting all that together, what do we have here? So step 1, is this right? Okay, so we'll look at dimensions of reviews, some definitions, and then some examples. So one of my favorite authors who writes about systematic review methods is Gao or Goff. I'm not exactly sure how to pronounce his name correctly. And so he has this short article where he's trying to clarify the differences between all the different reviews. And he noticed that they vary on how broad or in-depth they get on a review topic, how many different types of questions, whether they include theory, what's the logic. So he really put together this nice article trying to define it. Right now there's still a lot of discussion going on about what are systematic reviews, and a lot of times people will point to the definition that came out of the Cochrane collaboration many years ago. And Cochrane's definition is very focused on clinical effectiveness. So I'm going to give you a little bit broader definition, and this is what helps me when I'm especially working with clients who are coming to me maybe from a health-related topic, but it may be in public health where we're getting more into education or policy and things like that. So I forgot those arrows were there. Okay. So here are my 3 basic definitions, comparing narrative, scoping, and systematic reviews. So whenever I'm working with a new client, I always start off with, let's talk about what a narrative review is, because that's something that I already feel very comfortable with. They've probably written many before. And so basically a narrative review, the aim is to summarize what's out there. Sometimes when they think about a systematic review, what they're really thinking about is a narrative review done systematically. So when I ask them, what do you think a systematic review is? They will say, oh, well, I record everything that I'm doing, and I make sure to put all that in my methods, and I have to go through everything. And there really is more of a fundamental difference between narrative and systematic. In a narrative review, it's kind of like their opinion. They may still be trying to support it with evidence, but a narrative review is still more of an opinion paper. It doesn't have a research question. So a systematic review is where they have a research question that can be answered by studying studies. And that's one of the easiest ways to explain it is a study of studies. I tried to write that once into a book chapter and they said, oh, that's too short, but that is really something that is very helpful, I have found in working with clients. I do like to mention a scoping review in here because scoping reviews have become much more popular. It's the last search I did in PubMed, there were over 500, I think, in there. And so scoping review is kind of in between those two ideas. So it has a broad question like a narrative review, but it does detail the methods, and it does have a selection process and a little bit of a coding. The key thing that it's missing is that critical appraisal part, which I consider one of the hallmarks of a systematic review. So when we look across this as a spectrum, we see that the narrative review tends to be very subjective, very broad question, and for the most part, the methods are very unclear. The reader is not sure exactly what the author did to find what they're including. And then as we move more towards the scoping, the systematic, and then finally a systematic review that has synthesized all the data down to this one number, that is going to be hopefully very objective and having minimum bias. The question is very narrow, the methods are very clearly described, and the studies are appraised, and that's having one that's very well done. Now, one problem when we think about this is sometimes people think narrative bad, meta-analysis good. So really the issue is what is your question and which method matches it the best. It's not that a meta-analysis is the best, is better than the narrative review, but it does depend on what kind of question were you trying to answer and what makes the most sense. We can't always synthesize the studies that you have found into a meta-analysis. That doesn't mean that the systematic review isn't a great idea or isn't well done. So then in thinking about the systematic review steps, a few years ago I came up with this acronym that has helped me to, when I am talking with students about what are the steps of a systematic review. So the P stands for planning. So this is where we're framing the question, determining the criteria, considering what do we need to do for project management. The P could also stand for protocol. As many of you might have read or seen that there is this big push to try and get systematic review protocols registered. And the idea being that others can then make comments about the protocol and can also know that you're working on something similar with the idea of registering clinical trials, although not quite as important. I think registering clinical trials is very important. The I stands for identify, and of course this is where most of us are brought in because this is where they need to determine the search terms, what resources are going to be used, and documenting that process. And the E is evaluate. That's where you're going through. You're sorting relevant, not relevant, and that key point of critical appraisal. C is for when you're collecting the data and you're coding it, it's figuring out the forms and then bringing everything together. The E is where you explain what does all this mean, good, bad, putting it into context, all of that. And finally, the S is for writing up that report and getting the word out there. Through all of these steps, the goal is to be very transparent. The ultimate goal is that as a reader, I can tell exactly what someone did in their review so that I can decide for myself whether or not that was appropriate. Without a good description, it's hard to know exactly what they did. We also want to try and follow the standards that are out there, and depending on your topic and the discipline, those standards might be slightly different. I will always strive to meet the standards of Cochrane because I feel like their standards are held up so high, and also they've been around for a long time and their standards are very well written. And the ultimate goal is to minimize bias, whether that's in how are you framing the question and selecting the criteria, where are you searching, and what outcomes are being included. So that is the ultimate goal. Oh, well, kind of gave away the answer there. I thought we'd go through some examples. And I'm not sure why my animations aren't working quite right. But so I wanted to do a couple of examples here. So in this question, if somebody came in my office and they said they wanted to do a systematic review, and they were looking at open access efforts and what does this mean for libraries, I would say that that is a narrative review kind of a question. And we'd have to work on that a lot in order to turn it into a systematic review. Can anybody think of a different way you might phrase that to turn it into a systematic review? You can go ahead and type it in the chat box. See if any brave souls will give me some examples. Comparing it with another standard for providing access. So when we're thinking about what kinds of questions we're going to ask, then we need to think about what kind of studies are out there. Okay, so one question may be, what are the effectiveness of interventions to improve open access at universities or something like that? Oh, what is the research outputs? That would be a little bit different. So if there have been studies done where they looked at open access versus no open access, then I could do a systematic review on that. But it wouldn't be a systematic review if I were actually the one who were going in and looking at the research output. Does that make sense? Okay, so I can say that again. This is one of the really important parts of systematic reviews, is trying to sort out the questions. This is the part that really should take the most amount of time, is figuring this part out. Okay, so remember that what we're looking for are studies. So whenever we're framing the question, there've got to be studies that have already done that. So that was a great question that you were saying, okay, open access versus non-open access and the publication output of the university. So as long as there were studies where there were multiple studies that may have looked at different universities comparing open access to non-open access and looking at output, that would be a systematic review. But if I myself were the one going and gathering that data, that's a different kind of a research method, because I'm actually pulling and doing the work myself. That's a primary study. A systematic review is a secondary study because it is a study of studies. Okay. There we go. Okay. So, so I just wanted to spend a little time kind of going through these, and I'm worried that when I go to my next example, that it's just going to be showing you the answer. So I'm just going to press escape here for a second, and I'm going to take this off. So give me just 1 second here. Slight technical issue, and now we're back. Okay, so here's another example. What kind of review would you say this is? Yeah, so you can see how this is so different from that last question. right? So can anybody point out like any one word or any one thing about this that kind of got you to thinking, oh, systematic interventions part, okay. So typically when people think about systematic reviews, especially if you've been looking at a lot of Cochrane reviews or meta-analysis, is a lot of them are involved in looking at effectiveness of interventions. And basically the Cochrane handbook is written about how to do a systematic review, clinical effectiveness systematic reviews. And in a minute, we're going to talk about there are lots of other questions they could answer with it. So one of the key things in here is the effectiveness part, but also how specific it is one of the more important parts of this. So it's very specific about the type of intervention, what does it do, what population we're talking about. So we see all of those key details in there. So what about this one? You got it right off the bat. That's great. So one of the hallmarks of a scoping review is that it's a little bit broader question. And so this one you might kind of see also how it could fit into a narrative. So the whole idea of putting these into these kind of naming what kind of review is that, what does it match, it is on a spectrum. It's, you know, you could turn this into a systematic review question, the same as we were doing with that first question. So it's all a matter of scoping it and getting it just right. And it's something that is a dialogue between you and your client, or between you and the research team if you're working on a team. And so we're going to go into some more details about figuring out if they come in with a broad question, then where can you go from there and what else can you do? So step 2 is establishing the scope of the review. One of the things that I ask my client to do is to actually write out their question, because all along the way we need to be pointing back to that. We need to be always recognizing that every step is building on that original question. And sometimes when I see they're kind of getting off track, I say, remember what was your question? Point back to that. Sometimes I even suggest that they tape it onto the top of their computer screen as a reminder of what are we doing all of this for. We're also going to look at different types of questions and frameworks and criteria. So whenever a lot of people think about systematic reviews, they think about that effectiveness of interventions kind of question. But there are actually lots of different types of questions they can answer with a systematic review. And one of those is prevalence. So what is the prevalence of autism in elementary school children? Or I've done a couple where we looked at some very rare disorders around the world. And so there's all these different types of questions. You can do economic, you could look at how a certain theory has been applied, qualitative questions which get into meaning, experience of a population, so lots of different types of questions. So next thing we're going to do is look at some different frameworks for these different kinds of questions, and where does PICO come in? Okay. So a student had a question of what is the prevalence of eating disorders in college students? So as a systematic review, you could look for studies that had looked at prevalence for college students, and you can bring all those together and get a bigger picture rather than just looking at one individual study. So that's a good example. Okay. So these are some different frameworks for some of those different kinds of questions. And so we see the popular PICO there for intervention questions. And so there, you know, we're filling in the population, the intervention, what are you going to compare that to, and what is the outcome? But you could have a question of where it's more about a certain exposure And so I recently heard, it's maybe been a couple months, about children who have to wake up really early to ride the school bus and whether or not they're getting enough sleep. And so if there had been studies done on that, then I could look at how much sleep are they getting because of riding on the bus. We could also look at diagnosis. So this one is kind of an easy one to fit into that PICO, but this is a little bit modified to fit into the diagnostic kind of a question. And then you could also look at prognosis. This is where a researcher is trying to come up with a model of how does something work and what are the factors. Sometimes they use that term, factors. So here we're looking at which patient or population are we looking at, what outcome are you trying to predict, what is it going to be intended for, and where are we looking at. So in this case, the example is, what is the model or what are the predictors for when pet owners will evacuate when mandated? So I did have a client who was recently looking at this question. And so we were looking at surveys before and after an evacuation mandate and looking at the pet owners and seeing why they were choosing not to go. And some of it was also qualitative, was based on interviews. And so it's a way of starting to build up that model. So I have any questions about that? Y'all are asking me great questions, and I'm glad you're chatting with me. Okay. Well, if you have any. So now we'll look at eligibility criteria. Now, sometimes when I say this, I get kind of this quizzical look of for population questions. Okay, with any of those, you could switch them to be population questions. So definitely you like with the exposure kind of question, that is more population-based. So with any of those, you can change the P from patient to population. And actually there are lots and lots of other frameworks. I didn't want to overwhelm everybody with all the different frameworks that are out there. But I would be happy to include some more and tell you about some more examples if we have time at the end, or I could send that out as a link. I discovered lots more, especially as I answer lots of public health questions. Clients sometimes get confused with eligibility criteria, and one thing that they confuse it with is with the search criteria. So it's important that I sometimes will phrase it a different way, and I will say, what are the characteristics, or what does a study have to look like in order for you to include it in your systematic review? Another example, a way of thinking about it is, what kinds of studies will help to answer their question? And so we're looking for studies that have all tried to answer the same question. They may be answering it using different methods, but they all need to be aimed at answering the same question. And so I gave the example here about nursing students going to bibliographic instruction, and do they have higher grades the next year? And so start to list out the criteria. And of course, we're going to base the search criteria off of these eligibility criteria, but they won't be exactly the same. And it's really important to have them listed out, because this is something they're going to have to keep pointing back to as you go on to the next steps. So after I start to understand their question, I start to think about it more, then that's when the very first search that I'm going to do is I want to see, are there any relevant reviews already out there on this topic? And so I'll usually do that with a client in my office, and that's the first things that I'm going to ask them to read, because this is going to help them to, if they don't understand what systematic reviews are, this is a chance for them to read reviews about their topic. And I'll also give them kind of a homework assignment, which is in creating a table, which I'll show you in just a minute. So these are the 4 steps. So, of course, there are lots of places to look for reviews, and it's going to be very dependent on what their topic is. Also within their discipline. For example, I have done several systematic reviews focusing on education. And so one problem I have found in disciplines outside of medicine is they don't always have that term systematic review in the title or the abstract, even though that's what they did. And this happens a lot to me in public health kinds of questions too, depending on the discipline. So if it's more into policy and some other areas that public health gets into, they may not have framed it that way. But I try and do the best I can to see if there are reviews out there. And so there are lots of different places to look. There are different, so we have the databases that are specific to reviews, and of course in subject specific like Medline, PsycInfo, CINAHL, those kinds of things. You might even look at dissertations and theses. I know on our campus more and more departments are requiring that students conduct a systematic review as their literature review. I've had several departments kind of just declare that's how it's going to be. So one thing if I'm advising my clients on how to do this that I tell them is that we're looking for a smaller set of articles, so don't try and put in all of your search criteria that you might do when you're going to go and try and find all your primary studies. I try and keep the search terms a little bit broader. And so I'm trying to find something that's related. And so what I'm going to do with that is I'm looking to see what kinds of questions were they answering. Were the reviews answering the same question? Is it close but not the same? Or can I find there's like no reviews out there on this? So close but not the same is my favorite because of course then I have something to talk about. But it's not exactly the same. And then exactly the same question, well, I'll start to look at how recently was it conducted, when did they stop searching, and we're going to put all this together in a table, and I'll show you that in just a minute. So I'm trying to consider how different is mine going to be? Do I need to take a little bit different perspective? Or is this going to be more of an update of that review? So let's kind of go on more into these steps and you'll see how this all comes together. Oh, so that's a great question. In PubMed, would I limit the search to reviews or systematic reviews or both? I would start by limiting the systematic reviews just because there may be many, so I don't need to talk about the literature reviews on that topic. So it depends on their topic really and how many you're going to get back and kind of what's out there. I tend to use the search filter that was designed for PubMed on how to get back the systematic reviews, and so I think that that's one way of doing it. And I also like to use PubMed Health for finding systematic reviews, as they've done a little bit better job of tagging them. So that's great questions. Okay, so from this, I asked the client to create this table. And so I just kind of give you a little example here. And so I will do a search, and let's say it came up with 50 potential review articles. I will ask them, okay, please go and sort these, pick out the articles or the reviews that are most related to your topic, and then create this table for me, and then we're going to look over it next time. So I asked them to label what type of review is it, what was their research question, how far back, and what resources might that have searched, and that gives me an idea of their scope. And then also, do they tell you about their methods? How well do they describe them? One of my favorite tools that I use now for looking at the risk of bias in systematic reviews is called ROBIS, which stands for Risk of Bias in Systematic Reviews. And so I put the URL at the bottom of this slide. And you do have things that are called systematic reviews but aren't really. And so sometimes I might put into type of review was called systematic review, but it's really a scoping review. And especially when I start to look outside of medicine at different disciplines, that's where I really start to see big differences in what they'll call things. But sometimes I also see that in medicine as well. And I also got a message saying that she also searches Prospero in different places for existing SRs. So depending on the topic, I might search Prospero. So definitely that's a place to go. And it has definitely grown in popularity. So we're starting to see it more populated now. So that's a good point. So the reason why we're looking for reviews is, one, you would like to know, has anybody already done this? But there are other reasons to also do that. One thing is that review authors really need to include and talk about the related reviews in their introduction. So one thing that students new and researchers new to this process they run into is they're not sure what to put in their introduction because they're used to doing this literature review at the beginning of describing a study that's going to include all the studies that right now they're including. So really what you're doing is you're wanting to set the context of where does this review fit in with other reviews. That's what really should go in the introduction. So your introduction is, why is this topic important? Why are you doing a systematic review? And where does it fit into the other systematic reviews? Or if there haven't been any narrative reviews. So then in the end, you're going to come back to those reviews and talk about where do your findings fit in with the previous systematic reviews. We also want to look at screening and the included, what did they include? Should we include those? Looking at their methods, what kind of search terms did they include? And look at the results of how their data was presented. And that starts to really get the client in thinking about what are they going to do for theirs as well. Okay, so everybody's listing lots of different places to search, and I think that that is great. There are so many different places to search for reviews right now. Trip is also one of my favorites because of where they're collecting from so many different places. So there are lots of places to look, and especially depends on what your topic is. So I think that's great that we're sharing those. So the next step is in looking for potential studies. This helps to start thinking about how are we going to search for these, but also if they haven't come to you with some examples of studies they want to include, this kind of helps us to start knowing, are there any studies out there? Because some topics I hear, I really wonder, are there really any studies out there? So we're going to go over these steps. So one of the first things to do is to look at their criteria of what do they want to include, and then figuring out what should I include as search steps. So these are the concepts that Cochrane calls for including. One is the condition, the second is the intervention, and the third thing they usually include is the study design. You could even add into this part if you were looking at a very specific population. In this case, they didn't limit it down to a certain population, but that also might be included depending on how many studies are out there. And so I gave you, this is an example of a study looking at chocolate for cardiovascular health. And so you see basically they have one line because there's no tag yet or at this time when this was published for chocolate, so we just see they did that as keywords. And then they have a set of terms for cardiovascular disease. And then they have the search filter that was designed to find all the randomized control trials within Ovid Medline. So sometimes I am working on reviews where we're not going to be limiting down to the study design, and so sometimes I have to be creative in how we're going to narrow it down. This is especially true in certain areas, especially with public health, where we really want to look at lots of different study designs. So I have one question about qualitative research and study design. So there have been a few filters for qualitative studies, and so I'm writing down this as a list of things that y'all have asked me for that I could send you. So qualitative studies can be very tricky to find because there are so many different method types, and then how does the author describe those and how are they tagged? And so there have been a couple of good filters on that. So I'm just writing that down. Anyways, so one person was commenting about the how animal studies were excluded from this. This is actually the filter that is suggested by Cochrane in how do you filter out anything about animals from Ovid Medline. One issue that I discovered kind of early on when I was helping clients on reviews was that when I limited down to humans, I immediately knocked out several key studies that we wanted because they were not labeled with humans. And so I kind of proved it to myself at that point that limiting to humans was not useful. And one problem is that it's one of the most forgotten tags. But if it's a study about animals, they almost always remember to label it as animals. And I especially have found it to be true of several public health studies. They don't label those as being about humans. So it's something to consider and to look at. So when I'm looking over the results, of course, one thing we look at is the number. And so about how many are you expecting to go through? And of course, that's going to undergo some changes because right now you're just kind of doing this quick search while you're working with them. But it does give you some idea, and so you're going to continue to play with this. Oh yes, I'll send it out to everyone. So we'll get that posted, hopefully. So the first thing I ask them to do is I'm going to give them the first 50 articles or citations that come up in that just real quick kind of a search. And so that's part of their homework for the next time we're going to meet. So ask them to go through those 50 and sort them into relevant, not relevant, and then I want to see the results of that. And so one thing I'm trying to find is I'm trying to find 2 to 3 studies that match their eligibility criteria exactly. This helps me whenever I'm trying to test out my searches, especially when I go into a new database. And it's also a chance for their team to test out their eligibility criteria. Oh, no, I'm sorry. Right now I'm talking about individual studies. I'm sorry, maybe I didn't make that clear. So right now we're trying to figure out the potential group of articles that they would have to sort. And so we're still in the feasibility stage. So is it feasible that we can do this? It lets us know if their question is really broad and they're getting back 20,000 articles with their search criteria, is that going to make sense, or how can we scope it differently? So right now we're just kind of doing a test to see for the individual studies. So I'm trying to figure out how much is out there. Do we need to alter the eligibility criteria anymore? And so I usually just give them that first 50, and I'll show you one of the tools I use to help them to do that part in just a second. Oh, it's the very next slide. I forgot about that. So this is one of my favorite tools I'm using right now. I have probably 40 to 50 review teams using this right now, so done a pretty good test on it. So it's called Rayyan, and I have the URL down at the bottom. This is free, which is awesome. It's very easy to sign up for it. And so basically, the screenshot that I gave you here is I uploaded about 50 articles in here, and this was a test where I was sorting them. So over on the left side, you'll see these different parameters and where different labels in there. So at the very top, we have undecided, included, excluded. Right now in the middle, what you're seeing is all of the studies that I collected. Red, and my name in red means that I said exclude. And then down at the bottom, you'll see that I have one of the articles which I labeled as included. I selected some terms that I would like it to highlight in green where it says keywords for include. And so basically what I do is I take my undecideds, I can click on that, and then I mark include, undecided, exclude. I can add my own reasons and put in my, and label this as I would like to. This is similar to Covidence. One issue that I've run into Covidence is the cost. And so most of the students I work with don't have the money. So I was trying to find something else. And yes, groups can work together. I didn't make a screenshot of that screen, but I can go and invite multiple people into this. And so I have many groups that have multiple researchers going in and labeling things. And one nice thing is you can see up at the top here under inclusion decisions is it says conflict. And so those are the ones where they disagreed. Right now I have the blinding turned off, but I can turn that back on so I wouldn't be able to see the answers of others. They can even chat with each other in here, and so there's a review chat. You can import from multiple types of files, including RIS. It works well with PubMed, XML, from RefWorks, from EndNote. You can also export into RIS and into just an Excel spreadsheet, into EndNote, RefWorks, different places as well. This is mostly for pre-screening. It's not for developing forms. I use Google Forms or Qualtrics to do my coding. For me, Covidence was just too limiting. It's been a while since I looked at their forms, but they look like they were mostly focused on randomized control trials. Last year I did 380 consults, and of those, I would say less than a handful were just focused on randomized control trials. So I just found it to be too limiting. Now, if you're doing randomized control trials, I think Covidence is great. You can export from EndNote to Rayyan. Yes, you can go from EndNote to Rayyan and Rayyan to EndNote. So I think they've done a pretty good job on that. Anyways, I didn't want to spend all of our time on this, but I can tell you that the first time I saw Rayyan, I did get goosebumps because I quickly realized how quick and easy this was going to be. And can you export, import from Excel? Yes. As long as the Excel spreadsheet, as far as importing, the Excel spreadsheet, certain information has to be labeled well, but definitely you can export into Excel. It goes to CSV, but same thing. These are great questions. Okay. Are there any other questions about this? So I have 5 minutes. Okay. So we just have a few more slides, and this is going to be where we're going to bring everything together. So in determining feasibility, we're thinking about, now that we've had this chance to look at what are the previous reviews about how much stuff is out there, how should we limit this down, you really want to finalize the scope of the review and consider all these different aspects we've been talking about. So in scoping the review, I'm thinking about how much time do you have, how many studies are out there, what's going to work. And of course, sometimes they come to me with these very unrealistic expectations of time. I will be working with them in that first meeting, and then at the end, I'll say, okay, how much time do you have? And they'll say, oh, it's due in 2 weeks. And I'll say, okay, this isn't going to work. So it's really important in that first meeting when you're talking through that question, finding out how much time do they have. And I'm sure some of you who have had even just a few consultations have run into that. So the time, it's sometimes hard to say, right? But it's really dependent on how much sorting are they going to have to do. So let's say I've had a few reviews where the most amount of studies we found, the citations we found for them to sort was less than 200. And so they were able to do it in about 6 months. More realistic is a year to a year and a half. And sometimes you can add on more time depending on how big their team is. So a really good sized team is 3 to 4. Sometimes when you're getting into like 10, 12, the more people you add on, especially if everybody needs to have a say in what's going to happen next, it can slow down the process. That's a good question. So in considering all these things we talked about, they may need to change their question, the criteria may change. They've got to finalize that and kind of settle that in place. You don't want to have what I call scope creep, and this is where they start to relax on some of their criteria and bring in other things. That's where I keep pointing back to the original question and the original criteria. It's really important to keep to that. This is just a few frameworks that are out there in what factors to consider when thinking about your work. And so Feiner is one, and he was looking at, is it feasible, is it interesting, novel, ethical, and relevant? So the interesting and the novel part, I think, comes in with by looking at the previous reviews. Has this been done before? When I think about relevancy, I try and think about what are the stakeholders, where are you going to write this to? And then for Booth, who just came out with his newest edition of his book, which I'll show you in just a second, he's one of my favorite authors on how to work on reviews. He came up with this term of tread. So do you have the time, the resources, the expertise, or the ability to call on those experts? Who wants this, and are there studies out there? Is there data available? I put together this quick slide of some of my favorites out there. This very first one that I have listed on there, you can actually Google, and you could get the whole PDF of one of the older copies of the book by Pettigrew and Roberts. One of my favorite parts of that is that the very first chapters really help to give examples and to place systematic reviews into context. And they talk about this idea of, does this match this framework of the systematic review, how to figure that out. And I have found that to be really helpful, especially when I'm working with faculty who are really new to this and they really want something to read. I think he does a really nice job. Now, my favorite book for how do you do this process is Booth's book. And he just came out with the second edition in July. And I was actually finishing up writing my book, which is the one I put down at the bottom. And I kind of feel silly like showing you that, but I do want to show you this. So we did focus on, this is a guide for librarians, so it's written from that point of view. And it is coming out in March 1st. And so I've reached the last slide. I've been very excited to be able to see your questions and chat with you. And I have written down some of the different questions that you asked me, and hopefully we can put that out at least into an email to everyone.
Hi, Margaret. This is Brian Leaf again. Yes, we can absolutely do that. So not to interrupt, I want people
Sure.
to be able to ask questions. We still have a few minutes for people to ask questions and for you to answer, but Sarah just has a couple of housekeeping items before we end. Sarah?
Okay, so then I'll stop sharing my screen. Okay, there you go.
All right, thank you very much, Margaret. So first off, I'm going to go ahead and end the recording.